Hey, welcome back to my channel. This is Nasu, Fight for Kidneys. Why are we fighting for kidneys? Because kidneys cannot fight for themselves. We are here to advocate for our kidneys and talk about kidneys and fight for them. Because kidneys, unlike any other organs, most of the time they are forgotten child. They are those organs that most people don't talk about it. That's why we are here to say, let's talk about kidneys, let's fight about kidneys. And here are our kidneys. Bean shaped, size of our fist. Today we'll look at things that can put us at risk for kidney disease. We have highlighted a few things because those are the highest that put us at risk for kidney disease. And without knowing about our kidneys and knowing about the status of our kidneys and what really put us at risk for kidney disease, we cannot do anything. So how do we know about our status? And how do we know we are at risk for kidney disease? Number one is family history. I work in a dialysis center and I see it all the time, where a father, a mother, their children, and their grandchildren. That's two, 3 generations. Yes, they have kidney disease. And we need to talk about it. Like I said earlier in my previous channel, and I hear it all the time, even when I work in a hospital setting. You hear people say, "Oh, don't let anybody don't tell anybody I'm on dialysis." Or when my family members come to visit, don't say I'm in dialysis. Say I'm getting another procedure. I'll be there in a few hours. We have to talk about it. We have to talk about it. And until people know what you go through about kidney disease, that's how they can prevent themselves. And especially family members. So if my parents were in dialysis, and I know what put them in there, what were the risk factors, what caused their kidney disease, then at an early age, I'll take those, I'll advocate for my own kidneys. I'll start asking my doctor those questions. So family history is important because it puts you at risk. If you had generation where your parents or your grandparents were at risk or had kidney disease, that can put you at risk for kidney disease. And it could not just be because of diabetes. There are other conditions that can put you guys, polycystic kidney disease. It's a family history that can put you at risk for kidney disease or put you at risk for kidney damage or your kidneys failing. The other reason is health issues. Like I have said, diabetes and blood pressure are number 2 reasons why kidney disease is so high, because those numbers are going up. And high blood pressure damage your kidneys, damage those blood capillaries in your kidneys. Blood sugar does the same thing. It damages those arteries by clogging them. And the next thing is cardiovascular disease. There's so many things can happen with our heart that can damage our kidneys. There's also obesity, high weight, overweight. If you're overweight, that can put you at risk for kidney disease. We know if you're overweight, if they check your cholesterol might be high. You might be diabetic. You might have high blood pressure, and that's that can cause damage to your kidneys. The other reason is ethnicity. We cannot change who was our ethnicity, where we are born at, what's our background. So if we are Native Americans or American descent, if you're Hispanic, that puts you at risk for kidney disease. And the main cause of those kidney disease, for those people, they end up having high blood pressure, diabetes, and there are really not really enough information to tell us why that those people. But just knowing if you're Native American or African descent, you are high risk, or you are Hispanic, you are high risk for kidney disease. Lifestyle. We know, like diabetes, it's a lifestyle. What do we eat on a daily basis? How do we live? What are those things we do on a daily exercise? Do we exercise? Do we smoke? Do we take drugs, illicit drugs? Do we take all these painkillers, medications? Those things can put us at a risk for kidney disease. It can damage our kidneys. That's why we have to watch what are we doing. And until we talk about it, when will people know, hey, if I do this, People, how many times did we hear about smoking? Most of the time we heard about smoking, and the only thing we heard about smoking that will cause damage, it will cause damage to your lungs. But until I was working in this side of this setting, that I heard, oh yeah, smoking can cause your kidney damage. But we never heard about smoking and kidney disease. So why is it important to talk about this, knowing your status and talking about risk factors? Because if we know it, early detection can make a difference. So when you go to your doctor and hey, your family history, you have high blood pressure, you have high blood sugar, your obesity, you smoke, you are from this certain ethnicity, you have cardiovascular diseases or other things going on. The more you talk to your doctor and those things can put you at risk for kidney disease, the more that your doctor will start testing those, doing those testings. And once you go to the doctor and they do those testing, they'll be able to tell you the status of your kidney functions. And then they'll tell you, those things that you can do something about it, the root causes. And if once you know the root causes, because they'll say, hey, it's A, B, C, D. Those are root causes. You can change where you are born, for sure. Those are things we cannot change. But there are other root causes that might trigger. They might do those other test and other testing and asking more questions, and they'll say, hey, this is what is causing your kidney function, this is what is putting you at risk for kidney functions. So what are the few things that can be tested? There are two tests that we can do to test our kidneys. One is urine. Everybody pee. And urine is important. Like I said in my other channel, just because you pee, you gotta check your urine and check. It can tell so much. Urine can tell so much about your body functions. So when they test the urine, you hear about, they're checking about albumin. They are also, or you hear albumin or protein. That's protein in your urine, and protein should never leak in your urine. It should never go through your kidneys. So if it's this protein in your urine, that means your kidneys has some damage that is taking place. But at the same time, not just one test. One test will not say, hey, you got protein in your urine, that means your kidneys are damaged. That might be different. They have to do different tests, and they have to do same tests, but they have to do them at a different times. They might take 3 tests. Some doctor might say, hey, we're gonna monitor for like 6 months. Other might say, we're gonna monitor this urine test for 3 months. It depends with what you talk with your doctor. You will say, hey, I exercised, or I did this, or something else was happening. So it's not just one test. But then they also they'll do another test that called glomerular filtration rate. This is where they are checking your the kidney damage, and then this is done by blood test. It's a simple blood test. They draw and they test for those glomerular filtration rate, and they have to put into account a few things to be able to calculate that number. And the things that they have to put into account is your age, your gender, that's whether you are female or male, your weight, your height, and your also, your ethnicity. Are you black or white or Hispanic? Those things, they have to put into that calculations, because those numbers tells us more. And then what they're checking about is something called, they also check about the creatine. And this is like muscle breakdown that should not be tested in your blood. It shouldn't be tested in blood. So if it's muscle breakdown, and if it creates that how do I put it to make it simple to understand? So you hear that word creatine, and that's the what it's produced after the muscle breakdown. I think that's the simplest way I can put it. They'll test it, and that's what we'll show on this lab test, and then your glomerular filtration rates. So when they say, then you hear them come and say, hey, your kidney function is a stage 1 or stage 2, stage 3, stage 4, or stage 5. So stage 1, really your kidney is function as it's supposed to do. Stage 2, it's still functioning. There's a bit of damage in it. Then there's stage 3. It's really, you hear about 45 to 60% of your kidney functions. That's how much is left. You have about 45 to 60% of your kidney function. And at that time, you might start to feel, or some other labs might show some changes in your body functions, or your electrolytes might see some changes. Then at stage 4, you have about 15 to 30 of kidney functions. These ones, now you have a bit more symptoms. You start feeling decreased appetite, you feel tired, you have you also feel, they might see also abnormal increased changes in your abnormal labs, your phosphorus, your calcium, your vitamin D's, although your I say phosphorus, your calcium and your potassium. That's the word I was looking for. And they'll see those labs and they might be abnormal, and then they'll say, hey, this is what we might say. Depending on the doctors, they might say, hey, we might start looking at, you might need dialysis, depending on the severity of the symptoms. When you're stage 5, that one, your kidney functions is gone. You're ESRD now. That's what you hear a lot, saying ESRD. And that's when they might say, hey, right now you are straight to dialysis. You need to have support with your kidney, support with cleaning your body and getting the toxins out of your body. And we'll talk about that dialysis. So to summarize this, it's very, very important. Because if you knew at stage 2, you are told, hey, there's a little bit of kidney damage, they look at the root causes. Say if you knew, they might say it's blood pressure or something, you need to control your blood. If you control your blood pressure, then that will slow the progression of kidney damage. So that's why we are here to talk about knowing our status, what puts us at risk for kidney disease, and how can we start the talk? How can we start the fight? We can only start the fight by talking about it, by discussing it with our family members, with our loved ones, with our friends, and asking our doctors. We should not be afraid to ask our doctors about our status, our kidney functions, because it's very, very important. We are the only people who can fight for our own kidneys. We can only fight for our own body. And the more we stop fearing and start asking questions and asking about those status, the more we can change, the more we can prevent further damage, the more we can live a better life. And knowing that 33% of adults in US are at risk for kidney disease. That's 1 out of 3 adults are at risk for kidney disease. And the worst part is that most people don't even know. They don't know their risk for kidney disease. They don't even know their kidneys are getting damaged, because it's not like you wake up with this pain. It's not like you wake up with a cough. It's not like you wake up with a headache every day. By the time you start feeling all these things, your kidneys have really failed to a stage that it cannot be reversed. But if you get to ask these questions, the doctors will be able to reverse those. That you'll be able to discuss with your medical doctor or your nurse practitioner, and they might guide you on things that you can do to prevent further damage. Please continue joining me, continue subscribing. Please like these videos, talk to your family members, share, and the more we share, it's the more we bring awareness, because we are here. A lot of people are here. We fight, and we gotta fight for kidneys because we have neglected our kidneys. We are not talking about our kidneys. We are not fighting for them. We fight for heart. We fight for all these other things, but it's about time we fight for these beautiful kidneys right here, and the ones you got, and the ones your family members got, and we gotta preserve them because we need to. Thank you for joining me, and until next time, thank you.